About 70% of all women will experience fibroids and the extreme pain that comes along with them. Many say it hurts their sex life, even their marriages. It's the unspoken side effect that we are bringing to light today. Moving past the shame and silence to start the healing. We're back talking about how to overcome painful sex caused by fibroids. OBGYN and sexual health expert Dr. Jessica Shepard is here to help. Here's the deal, guys. When you're addressing painful intercourse from fibroids, it's important to start by knowing your options to shrink or even eliminate those fibroids themselves. Gets rid of the problem. So Dr. Jessica has some options for women who do not want a hysterectomy. Of course, if you want to have kids, you can't have a hysterectomy. So Dr. Jessica, explain a couple of these procedures.
Which I think is important because women who don't want a hysterectomy have all these options. So the MYOMECTOmy is probably one of the ones that most people know about. And what we do is this surgical procedure can be an incision on the abdomen or minimally invasive, where we use the laparoscopic or the robotic procedure. But what we're doing here is we're essentially going into the abdomen and pelvis and looking for that fibroid. So you can see that those instruments there are actually going towards that fibroid and they're cutting it out. They're cutting out that fibroid, but we're still preserving the uterus. Therefore, you can still use it for childbearing purposes after.
Next option, the uterine artery embolization.
Yeah, this one many women don't know about. So as you see these major vessels, the interventional radiologist will put a catheter into and shoot all these pellets. You see all those pellets and beads going to the blood supply. They go right to the fibroid and cut off that blood supply. Therefore, that fibroid can shrink and shrivel up and get small.
Yes. So these are animations we showed, and 80% of women who have one of these non-surgical embolizations reported improving their sex life. 80%. They're actually measuring this stuff. That's how real it is. So it's not an excuse. The newest technique, though, is something called radiofrequency ablation.
Yeah, and this one I'm so excited about. I actually do this procedure, but this is new and innovative because it's a laparoscopic procedure, and it's done same day women go home.
That's the fibroid.
Yes, this is the fibroid right here. This is the actual radiofrequency ablation device that we put into the fibroid under ultrasound guidance while we're doing the surgery. And what it does is it delivers energy through electrodes right into the fibroid, therefore, again, causing it to shrink.
You can see it sort of almost frying this area.
Yeah.
It's like a raisin shriveling up. All right, so how do you